This module features Stephen Bizal presenting Improved Hyperbaric Treatment Options, Healing versus Healthcare.
Hyperbaric oxygen is very, very powerful stuff. It's probably one of the most powerful of the natural therapies available out there. And if you think about why, it just boils down to what's the most important nutrient for the human body? Oxygen. Then it would also make sense that oxygen is the most important nutrient for healing of every condition. Let me differentiate for you what I mean when I talk about healthcare and what I mean when I talk about healing. When I'm talking about healthcare, what healthcare means to me, as a chiropractor, healthcare has to do with the mechanical aspects of what I do. That means if you're a chiropractor, it's the manipulation of the joint. If you're a nutritionist, it's providing the nutritional chemical substances. If it's hyperbaric oxygen, it has to do with the hyperbaric oxygen chamber and the physics of hyperbarics, and you put them, and it's all the mechanics and the physics of what that's all about. If you're a surgeon, it's about cutting, all right, or it's about pharmaceutical drugs, whether you believe it or not. That's what healthcare is to me. It's all the mechanical stuff. In contrast, what healing is all about, in my mind, has to do with the concept of energy. You know, every cell in your body is wired at birth through the DNA and genetics to be able to take care of itself, heal itself, reproduce, and it doesn't really need our intervention. In a state of love, if you're in a state of love, all 50 to 100 trillion cells in your body have the ability to operate at their optimal potential. That means your eye cells, your nose cells, your ear cells, your brain cells, your immune cells, every system in your body has that advantage. Now, the way the universe works, the universe isn't prejudicial in the way it manifests things. Now, in contrast, anybody here ever been around somebody that's had the energy of anger, fear, guilt, frustration? Anybody ever been around somebody? Does that feel any different? Right. Now, just like the energy of love, you can't take the energy of love, put it in a package, send it to your mother or send it to a loved one. But there's no denying the experiential reality of what that feels like. Same way with these other emotions. When you're dealing with a patient, when you're dealing with a client that's in a state of stress, fear, that means whether you stick them in a hyperbaric chamber or not, they're still existing in an energy matrix that's being influenced by that. I won't even call it negative energy, I'll call it painful energy. And that painful energy then acts as a limitation to the physiological ability of the cells to reach their highest potential in healing. And in patients that tend to get better, I noticed three things. And they have to do with paradigm shift. The first paradigm shift was that they were able to make a transition from a reductionist model, the mechanical model, to a holistic. If it is true that we're comprised of the energy of spiritual energy, there's emotional energy, and an energy of thought as well as the physical, then any program we put together to try to help someone improve the quality of their life at any level and in any capacity that doesn't at least acknowledge and explore the interrelationship of that dynamics is in and of itself, what? A self-limiting paradigm. The second paradigm shift is the fact that patients that do the best seem to be the ones that are able to make the mind shift from a sickness care model to a wellness care model. And then the third, other speakers have made mention of the importance of the doctor-patient relationship, but the old paradigm is the doctor-patient relationship, where the doctor is God, right? And you get your marching orders, and you don't question, and you don't think for yourself. The new paradigm is all around empowerment, and it's empowering the patient to be responsible, to take ownership, and be involved in their own healing process. So those are the three paradigms. Your energy and how you interface with your patients and with your clients when they're scared and confused and I'm not sure and they have these disease processes. I mean, just think about where they're at a psycho and an emotional level, all right? And your energy has the ability to cause their energy to shift into a more positive place, which means that their physiology will be more receptive to the physics of what hyperbaric can do at a physiological level. Anybody here ever take a pebble and throw it into a pool of still water? what happens? Ripples. Which way do the ripples go? Out. Do you ever throw the rock, it hits the center, and the ripples start from the outside and work their way in? Could be the way the universe works, right? One of those universal principles. And what do the ripples represent? Who said that? Energy. We have brilliant young minds in the crowd, as well as the seasoned veterans. Energy. And when you watch the dynamics, are you actually pushing a molecule of water from the middle of the pool to the outside? No. I mean, you've seen leaves or duck or a twig sitting in the water. But if you visualize that, what you can see is that every molecule on the surface of that water is being affected by that energy. Take and expand that through a three-dimensional model, and then take and expand that to the human condition. The body is nothing more than a series of chemical reactions controlled by electricity. If you're in a state of love, all 50 to 100 trillion cells in your body have the ability to operate at their optimal potential. The new paradigm is all around empowerment, and it's empowering the patient to be responsible, to take ownership, and be involved in their own healing process. If it is true that we're comprised of the energy of spiritual energy, there's emotional energy, and an energy of thought as well as the physical, then any program we put together to try to help someone improve the quality of their life at any level and in any capacity that doesn't at least acknowledge and explore the interrelationship of that dynamics is in and of itself, what? A self-limiting paradigm. If you look at a lot of disease processes, and almost all without exception, what you would find is there is an emotional component. And what the emotional component has to do that you need to be aware of, it has to do with unresolved emotional pain in a person's life that affects that energy matrix in the body that affects the physiology.